For those of you here with me tonight in the room and others who are at home watching us, welcome to Natural Health Talk Show. If you like our show, subscribe us. Let us know if you like us. Thank you. And thank you for the welcome. What is behind this scary 800 gorilla image we put on the blackboard? There is a new hidden epidemic of kidney disease. It is a condition to be even more prevalent than diabetic and cancer. Kidney disease. A new analysis by the International Society of Nephrology, RSN, has discovered that among potential deadly ailments, kidney disease has now pulled ahead on the pack. Chronic kidney disease has reached epidemic proportions, and they are right under the collective nose of doctors everywhere. The experts want to make sure we all know diabetics and high blood pressure are common health issues among African in the Caribbean, and African American in the United States. This condition can damage the kidney over time and may even cause kidney failure. That's the most important subject we're going to discuss tonight. Kidney disease has no sign and symptom. Kidney disease often does not go away, and kidney disease can be treated. That's the best thing about it. If you get it early, it can be treated. Remember, you have two kidneys. You see in the blackboard, I put a picture to show you that you have two kidneys located near the middle of your back, just under your rib cage. Their main job is to filter waste and extra water from the blood to make urine. Waste can build up in the body when the kidney are damaged. That's the problem. Because when waste build up in the body, mean that the kidney are damaged. There was someone who raised his hand who asked, how will I be checked for kidney disease? The first is a simple blood test to assess your glomerular filtration rate, or GFR, which tell your kidney is filtering. The second test is a simple urine test for albumin excretion rate, or AER. You know, albumin is a protein synthesized in the liver that works to transport various substances in the bloodstream. When too much albumin is excreted in the urine, is a clear sign that the kidney may be in trouble or damaged. There are several conditions and lifestyle factors that may increase your risk of developing kidney disease. For example, if you have cardiovascular heart disease, mother, father, sister, or brother with kidney failure, if your family or you are a diabetic or high blood pressure, smoking, obesity, family history of kidney disease, those, please, the sooner is the better to be checked for kidney disease. What step can I take to keep my kidney healthy? The first thing you have to do, and I'm going to repeat it again for you, get checked for kidney disease. If you're a diabetic, manage your diabetics and keep your blood pressure below 130/80. There was one patient who called me last week. That's the reason I talk about kidney disease, because that person, the doctor, find out his glomerular filtration rate is very low, and he want to know, and I promise I will do the program for him and her. Warning sign of kidney disease. Please pay attention. During the early stage of kidney disease, you may show no sign or symptom at all. As your kidney damage progresses, symptoms may develop and worsen over time. So you must keep a lookout so it doesn't go unnoticed, and you can get it treated as soon as possible. Producing urine is one of the main functions of your kidney. It is no surprise that you should pay close attention to your urine when monitor for early signs of kidney disease. Very important. Look out for include blood in your urine and increased need to urinate. Also, the appearance of cloudy or foamy urine. If you used to go to the bathroom, your urine was clear, yellow, not that much yellow, and suddenly it becomes dark, cloudy, foamy, please go to your doctor, have the doctor check for you for kidney disease. Remember, when your kidney is healthy, he produces a hormone called EPO, erythropoietin, signal your body to produce red blood cell. That's what the kidney produce. So as your kidney begin to fail, they produce less EPO, erythropoietin. The body produce less red blood cell. So not having enough red blood cell can cause anemia occur. So when your brain lack of oxygen, so when you have anemia, so your brain gonna lack of oxygen. When this happens, you're gonna feel tired, dizzy, or weak, and have trouble with your memory and concentration. That's very important. If suddenly you realize your face is swelling, or your feet is swelling, or both face and feet swelling. You remember when in one of my programs, I used to say to people to drink a glass of water in the morning to reduce facial swelling. Let me give you an advice. With kidney disease, facial swelling is unavoidable no matter how much water you drink. So, when your kidney are unable to flush out toxin, a buildup occurs that led to puffiness, swelling in your face. And also, sodium retention is another side effect of the kidney disease, which can cause swelling in your ankle or feet as well. Listen to me very carefully. That's why I speak very slow. If you suddenly you have localized pain, remember, your kidneys are in the back of your abdomen, on each side of your spine. If you are experiencing localized pain in your sides or middle to upper back, this could be a sign that something is wrong with your kidney. In addition to back or side pain, you will have another sub-symptom to look out is muscle cramping. Kidney disease can cause various electrolyte imbalance, such as low calcium or high phosphorus level. You may experience muscle pain or a pain and needle sensation in your arm and leg. Please, if you feel this type of pain, have your kidney check up, go to your doctor. And if you have kidney disease, it's very common to experience change in your taste. Sometimes people will experience metallic taste in the food. Why do you think you experience that? Because kidney is in trouble. Waste build up in the blood can make food taste like metal and leave a bitter aftertaste in your mouth. Unfortunately, this can make even your most favorite food difficult to eat. In addition to making your food taste differently, the waste buildup can also cause bad breath. You see, a lot of people with bad breath. I remember I have a friend of mine who had this problem. I was the one who forced him to go to his own doctor, and the poor guy was having kidney failure. Bad breath. Because what? I just told you. Waste buildup in the blood can make food taste like metal and leave a bitter aftertaste in your mouth. And also, because of the waste buildup, it can cause you bad breath. If your family tell you you have bad breath, please go check kidney disease, because kidney disease is a happen epidemic, the 800-pound gorilla in your body. And also, your kidney are responsible for keeping your bones strong and maintain the right amount of mineral in your body. You see, that's where natural medicine comes from. Because mineral, amino acid, vitamin, very important. Thank you. When your kidney cannot maintain a healthy balance of mineral and nutrients in your blood, what happens? You will have dry skin and itchy skin. You see, some people, they have a lot of itchy patch, keep scratching all over the body, right? Can occur, right? Dry and itchy skin. If you see you have dry, your skin is dry, and a lot of little patch, and you keep scratching, please have your kidney checked. Go to your doctor, because that's maybe the kidney is in trouble. Because why you have skin issue? Because typically rash resulting from kidney failure feel deeper than a normal rash and will be unresponsible to topical medication. Believe me, I have patients like that when I used to work in internal medicine. Those rash there, even you give them topical medication, they're very difficult, unresponsible to topical medication. That's my experience. Remember what I just said about waste, right? When your body is failing to flush out the toxin, because too much waste in your body, now the body cannot flush it out. The kidney cannot work. The kidney is responsible for what? To get away those waste material in your body. So now, when your body is failing to flush out toxin, it is normal for a severe buildup of waste and fluid to occur. So your body needs to get rid of it of this toxin one way or another. He can keep it forever. If he cannot take it out, what could happen? Which can result in long period, cause you nausea and vomiting. This nausea and vomiting can also cause you to lose your appetite as well, to lose weight, because you can eat. Every time you eat, you feel nausea and vomiting. Then you keep losing weight. If you, a guy who have acid, heartburn and acid reflux can make your life miserable, listen to my advice. You need to slowly wean yourself of it. Never go cold turkey. Use other method of acid control, such as cutting down on acid beverage, taking probiotic, not eating too close to bedtime. I see some friend when I go to their house, 9 o'clock, 10 o'clock at night, they're eating big food. And then after they finish to eat, they go to bed. My goodness, what is going on? I don't know. Sometimes I would say, oh man, you will die before me. And then one of my best friends died from heart attack. You see, please pay attention. And after, don't eat the moment you finish to eat. You go to bed. It's wrong. Don't do it. And you take a glass of water when you finish to eat. Take a glass of water. Take a 1 teaspoon apple cider vinegar. Put it in the glass of water. Drink it every day to help you with the acid. More important, one customer can call me on that. If you are listening to me tonight, listen to me, because you tell me you went to your doctor, they give you a dye, you vomit, you nausea, vomit. Listen to me. Before undergoing any type of procedure that involves the use of a contrast dye, discuss it with your doctor. What your chance of kidney damage might be. Find out if a more kidney-friendly dye can be used. And especially, make sure it doesn't contain a heavy metal called gadolinium. Make sure it doesn't contain that heavy metal, because there is certain dye who's not good for you or might cause you kidney damage. There is other med that can damage the kidney also. For example, laxative, antibiotic, which you should only be taken when your doctor prescribes you is necessary. Don't take them whenever you feel like, because those type of medication can create you problem. As well as OTC pain reliever, some medication you go to the pharmacy buy. For example, aspirin, ibuprofen, acetaminophen, or Tylenol. Those medications, please don't take them if you really don't need them. You should eat more kidney superfood in your diet, such as apple, blueberry, sweet potato, strawberry. And also look for food with high in omega-3 fatty acid, which include fish, such as wild-caught salmon, sardine, tuna. Those are things good for you. And if fish is in your dish, so you could go to a health food store, buy omega-3 supplement, easy enough to find. And let your doctor know that you are taking the omega-3 fatty acid. Make sure you are drinking enough water, especially during all this hot weather. One easy way to know for sure if you're drinking enough of water is to check the color of your urine. Pale, yellow, or even clear is what you want in your urine. If it's dark yellow urine, that's an indicator that you are not drinking enough water. A special supervised exercise program can improve the health of those with chronic kidney disease. Little exercise, walk from one block to the next, is very good for you. Don't stay home. You finish to eat, go to bed. That's not good for you. Also, researchers at Netherlands recently analyzed valuable research on chronic kidney disease related death, and what they found was outstanding. The review, which includes dozens of studies and nearly 350 participants, discovered one simple factor that set the survivance for chronic kidney disease patients. They see higher level of magnesium were associated with lower risk of death. That means the more magnesium a patient has circulating in their bloodstream, the less likely they were to succumb to kidney failure. A heart stroke, a heart attack or stroke, or any other potentially lethal event. Even kidney patients on dialysis can benefit from magnesium. Sure, that makes sense. Because magnesium deficiency can spike the risk of complications and diabetics, including heart disease. So, if you increase magnesium level by taking a magnesium supplement, there is a lot of different magnesium, but I like magnesium carbonate, so please discuss that with your doctor. Talk to your doctor about what type of magnesium is right for you, okay? I like magnesium carbonate, but you can discuss. Even the research find that magnesium carbonate is the best choice for patients with kidney disease. So discuss it with your doctor. One of the research form of the supplement mineral is magnesium carbonate, you see? But that is not your only choice. There is a lot of different magnesium. Your doctor will help you on that. One thing I can tell people, if I have kidney disease, why will I do everything in my power to stop the progression of the kidney disease or even reverse it from the moment that I'm diagnosed? So think about that. Taking a simple magnesium won't kill you, but tell your doctor. Your doctor will know what to do. According to the National Kidney Foundation in the United States, they see over 30 million Americans have kidney disease. Only 10% of them have actually been diagnosed with it. You see the reason I talk about kidney disease? They even see the number of older folks with kidney failure are on the rise. What step can you take to keep your kidney healthy? As I tell you before, get checked for your kidney disease. Get checked. Go to your doctor, have him check it. Manage your diabetics and keep your blood pressure below 130/80. Eat healthy. Cut back on your salt. Be active. Don't finish to eat and go to bed. You eat, walk on your block. 15, 20 minutes. I help you. Take medication as prescribed. Avoid medication can cause damage to your kidney. There is a lot of natural nutritional supplement. Ask your doctor. He will let you on that. I'm going to talk about medication. A lot of people call me about medication. What you think? Medication. Okay. I know that heartburn and acid reflux for people who have them can make their life miserable. If you are someone whose feet don't hit the floor in the morning until you have popped one of these drugs, it's time to take a big step back and find other way to get acid under control without killing yourself in the process. I'm going to explain that to you. For example, I'm going to give you an example. If you like someone who like acid beverage, cut down on your acid beverage, such as soda, coffee, and even some fruit juice. If you are considering stopping a PPI drug, they say proton inhibitor, you need to slowly wean yourself of it. Almost 3 years ago, several well-conducted and important studies found that taking proton pump inhibitor, those acid-blocking drugs such as Nexium, Praloxep, can put you squarely in the crosshairs of chronic kidney disease. Please, if you're on those medication for too long, one patient asked me that he's been on that medication for almost 20 years. Please go to your doctor, discuss that with him. Let him know that you know what you're talking about. But if you're on Nexium, Praloxep, Prevacid for too long, it can cause you chronic kidney disease. Talk to your doctor, maybe he'll change it for you. He will check your kidney to see if your kidney is okay. Many other studies have come to the same conclusion. People taking PPI, proton pump inhibitor, they call them, were up to 50% more likely to develop chronic kidney disease. Can put your kidney even more at risk from one of these tests of being diabetics, having blood pressure, or heart disease. It's not me saying it. Study. Taking a lot of non-steroidal anti-inflammatory drugs, as I tell you before, for pain, like ibuprofen or Motrin, Tylenol, aspirin, for pain. That also can affect your kidney. Being dehydrated, if you don't drink enough water, can also affect your kidney because your kidney is there to filter, to take your waste out of your body. If that does not happen, it can cause you chronic kidney disease. The kidney can be damaged. And taking this kind of drug for years, it can also cause you bone fracture, especially in the hip, in your wrist and spine. And it can even cause you heart attack and stroke and lower your immune function. Something that can lead you wide open for inspection, especially C. difficile, which has been referred to as deadly diarrhea by the CDC, Center for Disease Control. This is even the first time that kidney disease has been linked to those meds. The research from Johns Hopkins discovered that PPI proton inhibitor users were up to 50% more likely to develop chronic kidney disease than those who didn't take these drugs. So you see, it's not me saying it. Those are the research done. Even the Washington University team of researchers discovered threat to the kidney when analyzing data from more than 125 proton inhibitor users over the course of 5 years. It is time to take a big step back and find other way to get acid under control without killing yourself in the process. Before I go, remember, diabetics is the number one cause of kidney failure, and high blood pressure is the second cause. African American have a higher rate of kidney failure than any other group of people. If you have a family history of kidney disease, but When warning signs are not before kidney function is reduced, treatment may prevent damage. You should be regularly screened for kidney disease with regular tests. It is most easy to successfully treat kidney disease when it is detected early. If kidney disease progresses, it can lead to kidney failure, which may require dialysis or a kidney transplant to survive. Although all the symptoms we mentioned above are potential warning signs of kidney disease, the only way to know for sure is to seek a professional opinion and get tested. Go to see your doctor to be checked. The sooner you recognize symptoms and notify a professional, the sooner you can get diagnosed and start slowing down the progression of your kidney disease. If you recognize any of those early signs of kidney disease, or if you have a medical condition that increases your risk, you should schedule an appointment with your doctor. Please schedule an appointment with your doctor as soon as possible and have the doctor to check your kidney for kidney disease with 2 simple tests. He will take your blood, send it out to check for glomerular filtration rate, and he check your urine, check it for albumin to see if you're not putting the food for the kidney, putting too much protein out in your kidney. Because remember, kidney disease has no sign and symptom. I hope tonight you understand the reason I say the 800-pound gorilla in the room. Good night. As usually, I will bring you another program. If you like our show tonight, subscribe us. Let us know that you like us. Put any comment, and bye-bye.
You were practicing. Now I want you to put your hands together after practicing. Put your hands together. All right, guys, go. You can say that you're on, right? It was 41 years. All right. Amen, amen.
The 800-pound gorilla in the room. Kidney disease.
Put your hands together. All right, guys, go. Amen, amen.
Encore. Thank you very much for tonight. Thank you, and thank you.
You were practicing. Now I want you to put your hands together after practicing. Put your hands together. All right, guys.